Good morning to all. Welcome to the ECG interpretation made easy class. Today I am going to discuss about the QRS complex. I am going to discuss under these two headings. One is different forms of QRS complexes and duration of the QRS complex. The QRS complex represents the depolarization of the biventricles. In QRS complex, the first initial negative wave that follows the P wave is called as Q wave, and the Q wave is absent in some patients, and the amplitude of the Q wave is normally less than 25% of the R wave amplitude. The first positive wave that follows the P wave is called as R wave. The second negative wave that follows R wave is called as S wave. And in rare situations, a second positive wave that follows S wave is called as R dash or R prime. QRS morphology. So QRS complex is positive in all the three bipolar limb leads like lead 1, lead 2 and lead 3. And the QRS complex is positive in all augmented unipolar limb leads except in AVR, which is inverted QRS complex. And in chest leads V1 and V2, the QRS complex is usually negative. In leads V3 to V4, the QRS complex is biphasic. It will have both positive and negative complex. And in leads V5 to V6, the deflection of the QRS complex is positive. Different forms of QRS complexes. So waveforms greater than normal amplitude are denoted with a large case letter, whereas waveforms less than 5 mm amplitude are denoted with a small case letter. So capital R, small s. So tall R wave followed by a small s wave. On normal ECG, this type of pattern is seen in all limb leads except in AVR. Small q, capital R, small s. Small initial non-pathological Q wave followed by a tall R wave and a small S wave. A normal ECG, it is seen in leads V5 and V6. Tall R wave followed by a deep S wave, that's a biphasic QRS complex, is seen in lead V3. Small R wave followed by a deep S wave. Normal morphology in leads V1 and V2. Deep Q wave followed by a small R wave. This is seen normally in lead AVR, but when found in other leads, it is a sign of myocardial infarction in the corresponding heart area. Capital Q, capital S. A lone deep negative wave, it's a sign of myocardial infarction in the region near to the ECG leads, and it should not be present on normal ECG. RSR dash pattern, small R wave followed by a deep S wave and a second tall R wave is a characteristic sign of right bundle branch block. QRS duration. QRS duration is the time interval from the onset to the end of the QRS complex. So it represents duration of the ventricular activation in seconds. So how to measure? Start by finding the beginning of the QRS complex. Then measure to the point where the last wave of the complex transitions into the ST segment. It is referred to as the J point. So J point is typically where the S wave or R wave begins to flatten. So this is considered as the end of the QRS complex. So these two QRS complexes have easy to see J points, so it is easy to measure the QRS duration. But these two QRS complexes have less defined transitions, that it makes measurement of the QRS complex more challenging. And these QRS complexes also have less defined transitions. So normal QRS duration is 0.08 to 0.10 second. Increased QRS duration more than 0.10 second. Moderate prolongation of the QRS 0.10 to 0.12 second, and marked prolongation of the QRS more than 0.12 second. So causes of wide QRS complex, prolongation of the QRS duration implies that ventricular depolarization is slower than normal. So the causes are mainly bundle branch blocks, right bundle branch block, left bundle branch block, hyperkalemia, pre-excitation syndromes like Wolff-Parkinson-White syndrome, and premature ventricular complexes. So bundle branch block, the ventricle whose bundle is blocked will have to wait for electrical impulses to spread from the other ventricle. The spread of the impulse from the other ventricle will be slow, so the QRS duration is prolonged in bundle branch block. Hyperkalemia causes slow impulse transmission in all myocardial and conduction cells, thereby it causes prolongation of the QRS duration. And spontaneous action potentials discharged within the ventricles may depolarize the ventricles, so this causes ventricular premature complex. So you can see the VPC having more QRS duration. Thank you.